Come on, Sean. Go. Keep pushing. Grab those legs.
Tiger's behind you.
You got it. Try to let go, Sean. Try to let go. You gotta pump those arms. Here we are. Get all those muscles moving. You got it.
Okay. All right. And he's done.
Good job.
Nicely done.
Fabulous.
Great work.
So we'll take you down.
What the heck was that? That was Medcan CEO Sean Francis doing a VO2 Max test.
Okay.
So he did that back in 2020. And we're playing it because VO2 Max is a key measure of cardiorespiratory fitness. So that's the physiological property that you need to do aerobic exercise.
So basically anything that gets you out of breath.
Totally. And Medcan's rolling out a variation of that test, but one that is much kinder, far less intense.
Right, less shouting.
No shouting, actually. And yet it's still designed to provide you with an accurate measure of your cardiorespiratory fitness.
Right, it's known as the sub VO2 Max test, and it's becoming a standard part of Medcan's overall annual health assessment.
Which is the 5-hour super comprehensive annual physical.
So in this episode, we're going to provide you with the ultimate explainer on what VO2 Max is and why you need to care about it.
I'm Chris Shulgin. I'm Eat Move Think's executive producer.
Hi, I'm Jasmine Ratch. I'm managing producer.
And I'm Dr. Peter Nord. I'm the Chief Medical Officer at Medcan.
And I'm Dr. Andrew Miners. I'm the Clinical and Product Director of Sports Medicine, Therapy, Rehabilitation, and Fitness at Medcan.
The two of you are not just who you are as clinicians, you're also athletes. And so, Peter, can you talk a little bit about your athletic background?
Yeah, thanks, Chris. So I've done a bunch of different sports at varying levels, mostly just really enjoy being active and being, I really enjoy being sports. Going into sports medicine as my subspecialty early in my career was something that I had always planned on doing, even in med school. So I was a competitive cyclist and cross-country skier and a McMaster. I was doing these VO2 Maxes on a monthly basis. So we were using it to monitor our training, not just our aerobic fitness, but our anaerobic threshold, and seeing how our training was going. So had a lot of these tests done to me over the years.
Andrew, tell us about your athletic career.
My background, just like Peter, in a lot of different sports growing up, very active as a kid. And then into high school, I started to focus on football, and that became my passion. So I competed competitively at the university level and then in the semi-pro level after that. Before going into further education, becoming a sports specialist chiropractor. So not too dissimilar to Peter in terms of his path of his career, sort of being always led by health and fitness and ultimately sport.
So why are we talking about VO2 Max? Peter, do you want to talk about that a little bit?
Sure. So over the last number of years, as part of the annual health assessment, we were doing exercise stress testing. So that's where people are either on a bicycle or a treadmill. We hook them up to electrodes or just like an ECG while they're working away. So we were doing that to check their cardiac status. Do they have something wrong with their heart? Angina or blockage of the arteries. So fast forward, pandemic hits, and Medcan, just like every other healthcare organization across North America, stopped doing exercise stress tests because of the aerosolization risk that was associated with COVID. And so we were lucky. We had a blood sample that we've now been using. We've talked about it on previous episodes, high sensitivity troponin, which has been able to provide us through a blood sample a very sensitive way of looking at a person's cardiac status. We're forecasting heart attacks 10 years before they happen.
So the annual health assessment is really like you are constantly, and I think it is you and your team who are constantly using the annual health assessment. You're putting it up against the best assessments out there for overall wellness and constantly asking yourself, is this the best? Are we packing as much optimal measurements of health and fitness into this 5 hours, into these tests as we possibly can? And sometimes you're swapping stuff out.
Absolutely. Over the last 15 years, we've been constantly, with literature, new studies, we're constantly kind of scanning what's going on globally so we can pack the best value into that 5 hours of a person's time with us. And so that's what we're doing. We're finding that we're the only organization like us, I think in Canada currently, that's using this HS troponin as an example. Amazing benefit, lives saved as a result. And so the flip side is we're looking at the exercise stress test is saying, maybe that's not the best across the board screening test. And so we've taken some time and said, that fitness as literally the fifth vital sign of what we should be looking at people from their overall health, wellness, longevity, prognosis for the future, all of that is coming out of this VO2 test. And so that's something that we've now started to run. We're now just measuring heart rate and your response, your fitness response to increasing levels of work done on a treadmill or a bike. It's as simple as that, but the number that you get is highly correlated with longevity and overall wellness into the future.
Andy, do you have a sense of how many people are, because I don't think I would know what VO2 or VO2 Max is unless I had, unless I was producing this show. So can you give us, Andy, a sense of how many people know about this, and has that changed over time?
It's a good question. I don't have an actual number of what percentage of people would know what VO2 Max is. It's probably a large portion that have heard the term, right? Whether it's in reference to sports that they're interested or in the news or media, but actually understanding what VO2 means in relation to them and their particular individual health is probably not as well known. Particularly what they can do about it, whether it's low or high or acceptable, and what, if anything, they could do to change it. They probably don't have a great idea from that perspective.
You guys are talking a lot about VO2 Max. I think it would probably be helpful for some people to define that. What does it even stand for, to start with, at least? To provide us with that context, here's Medcan exercise physiologist Dustin Kahn, an expert in VO2 Max.
So what I'll first say is VO2, what it stands for is volume of oxygen. VO2 max stands for the maximum volume of oxygen that we can use. So when I breathe in air, there's about 20% of that air that is oxygen. That'll go into my lungs. From the bottom of the lungs, oxygen will diffuse into our blood vessels. Oxygen gets transported via the red blood cells to our working muscles. The working muscles then can uptake or utilize that oxygen inside the muscle cells. Everyone remembers grade 9 science and the mitochondria and the powerhouse of the cell. Within the muscles, the oxygen goes to the mitochondria, and it is within the mitochondria that we actually utilize the actual physiological process of using oxygen happens there. The more efficient my body is at that entire process that I just mentioned, from the lungs right down to the mitochondria, the more efficient my body is at doing all those steps, that cascading physiological pathway, the higher my VO2 max can be. That's the Cole's Notes version of a VO2 max.
So for all you listeners out there, VO2 max is measuring the milliliters of oxygen per kilogram of body weight per minute of exercise. And those scores can go up to like the high 80s. That number can look a lot lower for people who might not be working out for a living. So it's milliliters per kilogram of weight per minute.
Yes, of oxygen. Yeah.
Great.
How many milliliters of oxygen can my body use based off of how much I weigh in 1 minute? We want a high VO2 max. High is good with VO2 max scores.
And so give me an example of a high VO2 max score.
It depends on age and gender.
Right.
As we get older, our VO2 max generally lowers.
Okay. So what's like, are we talking 300? Are we talking 25? Like, give me a range.
So let's take a 50-year-old female. A super high VO2 max relative to that individual's body weight, because it's all based off of relative size of the person.
Okay.
Would be, so a high VO2 max for a female who's 50 would be anywhere above, let's say 45 or 50 milliliters of oxygen per kilogram per minute.
Now, Andrew, can we dig into that a little bit? Why should we care about VO2 and VO2 max? Like, what does that have to do with our overall health and fitness?
If we can look at how fit someone is, or give someone an insight into how fit they presently are and how fit they could be, and how that relates back to longevity, more particularly healthy longevity, living longer, healthierly, then that's what we want to do. And the fitness evaluation at Medcan has evolved over time. We've started off way back in the day not doing any stress testing. And then our founder, Dr. Bob Francis at the time, started doing stress testing. And then we started doing some muscle testing, some flexibility testing using the American College of Sports Medicine's fitness evaluation, which was a sit and reach test and a couple of push-ups. And then we've evolved that to do a more comprehensive look at muscle and joint fitness, your anthropometric fitness, which is how well your body is put together from a muscle and fat content perspective, as well as looking at cardiorespiratory fitness, which links into our VO2 Max, to give us an overall view or picture of how fit someone is relative to their gender and their age. And that helps for risk assessment, looking at how likely is that person to have a negative health outcome over time, or how less likely they are to have a negative outlook over time. And so that's where VO2 Max comes into. We know that exercise is medicine, but a lot of people don't exercise enough or have an idea of how much exercise is enough to maintain health or even improve health. So at Medcan, when we take that baseline testing, we give them an outlook, a window into their overall fitness level and how that might relate to their overall health and well-being based on all the other tests we do as part of the annual health assessment. And it gives people a baseline, that glimmer, that window into their health of where they can make positive change in their behaviors.
Okay, now I want to bring in a bit of tape from our archives because I think it plays into all this. It's from Dr. Jordan Metzl, who is a pioneer of the exercise is medicine movement. He's a New York City physician who leads these free, they're called iron strength workouts in Manhattan parks. He's partnered with the New York Times on the creation of a 9-minute strength workout. He's a prolific author, and he's on the editorial board of Runner's World and has run at least 35 marathons and 14 Ironmans. I interviewed him years ago after one of his park workouts on a street corner in Manhattan. Here's a snippet.
Yeah, I mean, the idea for me of doing exercise cure was that, you know, as an athlete, I knew how good exercise made me feel when I worked out. As a sports doctor, I knew that my patients and I wanted to keep my patients moving and active. And as a fitness instructor, I knew I wanted to kind of teach people how to do all this stuff. But putting it all together was really kind of taking a next step of not only exercise makes me feel good, but, you know, taking kind of a critical look at the science of the medicine of exercise. And what I did is I came to the conclusion that there is no more effective, safe, and basically risk-free drug that has the extra benefit of being equally, it works on every medical condition, you know, that I list and many others. It works for every single person, rich or poor, young or old, and there's no other drug like it. And so I started with the idea that exercise is good for you. I finished with the idea that this is in fact the most potent, safe, effective medicine across the spectrum of the human condition, and we need to make sure everybody takes this drug every day of their life.
Dr. Peter Nord, do you agree with Dr. Metzl?
Yeah, for sure. And over the last decades, the evidence to back up those statements is just massive. Like just incredible amount of scientific information, well studied in all these areas, large numbers of people participating in these studies, well-designed studies, irrefutable evidence, no question, exercise has a positive effect on cardiorespiratory fitness, cardiovascular disease, for sure. Things like mental health that we never realized before. The benefits on improving mental health. Orthopedic benefits, bone mineral density of weight-bearing exercise, falls prevention in the elderly, weight management, cancer reduction, diabetes management and treatment. Like all of these things. Again, if this is a drug, this would be a multi-billion-dollar drug.
One of the observations I make around that, most of the patients I see are active to some extent. Not all, but most. But when I look at the older patients that I see, patients that are in their late 70s or early 80s, and I see a big disparity between the patients that have been active their whole life and those that haven't. I've come in and I've seen gentlemen that are in their pushing 90 and, you know, they've got an ache or a pain, you know, they've got some arthritis build up, but who doesn't in their 80s?
Pushing 90? Did you say pushing 90?
90s, yeah. And these people are active. They've been active their whole life, and they've got maybe some arthritic knee or arthritic that because that's, you know, wear and tear over time. But when I ask them what they do for exercise, and this is people in their 70s and 80s, you know, they're saying, well, every morning I do this, and they stand up and they show me a calisthenics routine, right? Who uses the word calisthenics anymore? But they show me a calisthenics routine that involves some movement, some joint range of motion, some flexibility, you know, some body bends or some push-ups against the wall. And almost invariably, when I see these elderly patients, these older patients that are coming in who are in really fantastic shape, not just physically, but mentally, they have made exercise a part of their life every single day.
So we're going to get back to VO2 Max here in a second, but before we do, let's provide some context. We're at a time that's seeing the proliferation of screens and technology and streaming services encouraging sedentary behavior all over the place, like binge watching. And let's bring in COVID too. This is a disease that affects sedentary people much more than it does people who are fit. And this sedentary behavior is among the factors that, for the first time in decades, is stopping the growth of life expectancy and even decreasing it in North America. So up against all this, the medical profession and lots of other people like exercise physiologists who work in professions that involve exercise and wellness are trying to figure out, how do we increase activity levels? How do we get people off the couch? How do we get people to exercise more? Which brings us to the idea of vital signs. Peter, can you tee that up for us? What the vital signs are?
Yeah, so you learn this probably the second week of medical school. This is the first thing that every medical student learns because it's pretty straightforward. It gets them thinking sort of clinically, and it is body temperature, pulse, respiratory rate, and blood pressure. There's your 4 vital signs. And they've been around for decades because they give you a lot of information. Is there infection going on? The pulse rate itself, is it 100? Is it high? Is it low? Respiratory rate, we call it tachypnea. Are they breathing really, really fast? That tells you a lot about what's happening from a metabolic perspective underneath all of that.
Okay, so what we have is cardiorespiratory fitness, or VO2 Max, as a 5th vital sign that is being talked about. And one of the people who has been an enormous backer of this is Bob Ross, who actually, Andy, was your prof at Queen's, right?
Yeah, he did exercise physiology for me when I was in physical health education at Queen's, which they now call kinesiology, of course. But So Bob Ross, Dr. Robert Ross, is a kinesiology professor at Queen's University. He's he's a global expert in the interaction between fitness and health. So we have some tape from Bob Ross talking about the ongoing recognition that fitness is important to overall health.
Well, VO2 Max, or as I like to refer to it as cardiorespiratory fitness, is quite simply just a reflection of the individual's ability to transport oxygen to the working muscles in order to perform work.
And in this next bit, when Professor Bob Ross says fitness, he's using that so it's synonymous with VO2.
In other words, the higher your fitness level, the greater ability you have to do aerobic type work. And I think that's part of the intriguing thing about cardiorespiratory fitness, is that it reflects a biological or a physiological response to exercise that is truly unique. And what I mean by that unique is that because it's a reflection of changes in your cardiac muscle in terms of your heart and peripheral circulation, it's a trait that, because of that, explains risk, morbidity, and mortality beyond the common cardiometabolic risk factors. And here I talk about the cholesterols and glucose, insulin resistance, etc. And the reason it can predict beyond those very important cardiometabolic risk factors is because it is a reflection of something that those cardiometabolic risk factors are not. And that is the strength, the integrity of the heart and the downstream circulation. And that is, I think, a very important and unique feature of cardiorespiratory fitness, and why we believe it should be a routine measure in all clinical settings, because it provides the practitioner with information that they cannot otherwise get, no matter what they do. There's no other measure in clinic that can give them the same information about their client or their patient that cardiorespiratory fitness can. And in the American Heart Association statement that we published a few years ago, that was an underlying theme of that this was a very unique trait. Someone's cardiorespiratory fitness, their ability to consume oxygen and do aerobic type exercise, is a very powerful predictor of morbidity and mortality.
Well, also, I mean, certainly as part of
VO2 Max itself is a tricky test to issue. It's a tricky value to measure directly. And so, Peter, can you kind of explain that to us a little bit?
Maybe people have seen pictures of people like running full out on a treadmill with this big honking mask covering their whole face. That's the most accurate way. And in labs, absolutely, that's the way to do it. So you're actually measuring the amount of carbon dioxide going out, oxygen going in, and there's very complicated formulas by the computers that would assess that. And so it's a super accurate way, which per high performance elite athletes, you want to get that level of specificity because a change in very small amounts can be the difference between winning and losing in those elite athlete sports. So that's the VO2 max. So it's max just means to your maximum effort, beyond or at your maximum heart rate. Nobody wants to do that. We certainly don't want to put somebody in the middle of their annual health assessment day. We do not want to put somebody through that. So what we're doing is what we call a sub-max or a below max. And what we do, and we don't put a big mask on a person's face to do this, pretty darn accurate to look at a person's heart rate response. And this is why the stress test gave us a bit of a proxy. It wasn't really designed for it, but we are working people on a treadmill and we are measuring their heart rate. So why not kind of do the math and kind of see what was their VO2? What we're doing now is much more specific around the VO2 and less around the cardiac disease process because we're picking that up in other ways. So at the end of the day, that sub VO2 max is watching a person's heart rate based on a very regimented increase in the workload that we're applying to that person, either on a bike or on a treadmill, and watching that heart rate response. In somebody that's not fit, the response, as you can imagine, the heart rate screams up at very low levels of intensity. In a very fit person, as they go, there's like, we keep increasing the speed and the incline on the treadmill, or we're working on them, they're like, hey, this is nothing. Like, I got this. Like, my heart rate's not even increasing until we get to the point where more minutes, more time, more intensity, and we watch their heart rate slowly increase. What we'd like to get to is 80% of the person's estimated maximum heart rate. At that point, many people are like, you know what? I'm good. Like, yeah, I'm good to call this now. So by taking people to 80% of their estimated, it's a bit of a work. It's enough that we can see what's going on cardiorespiratory fitness-wise, but not enough to make it painful for them.
Yeah, it is still a physical test. We don't go to max, but we go to 80% of max. And that gets people thinking about their fitness. You know, if that is harder than they thought it would be, and then they're talking with their doctor, and their doctor says, you know, your sub-VO2 max test was below average for your age and gender. All of a sudden now that person's starting to think about their health, and now the doctor's pointing at some of their other metrics, their cholesterol, their blood sugar, you know, their blood pressure. And now they're starting to think about their overall wellness, and they might be starting to make that point, that little switch that goes off in the back of their brain that says, maybe I need to take a better look at myself and start becoming more fit and active if I want to stay healthy as I get older. And I think Peter's probably personally experienced it, and I know a lot of our physicians have, where people have had that aha moment, that light bulb moment where they say, I need to start taking better care of myself, or else I'm not going to see my grandchildren grow up. And so it can be very powerful from that perspective. Now, when people say my VO2 max is low, what does that mean to them? Should I try to change that? Can I change it? There's people that can change their VO2 with avid exercise, meaning that they're high responders to cardiovascular training and they can improve their cardiovascular fitness and their VO2 max number significantly, high responders. And then on the other end of the spectrum, there's low responders, people that have their VO2 max level and don't have the ability to change it that much, even though they exercise. And then in between that is most people where, as you say, 50% of your VO2 max is probably determined by genetics of whether you're a responder, non-responder, or middle responder. Wait a minute, 50% of this is genetics. You know, is it worth my while to try to go out and exercise? And the answer is absolutely yes. You know, whether you drastically improve your VO2 max score from 40 or 45 to 46 or 47 or even 50 is a direct result of your ability to carry on cardiovascular exercise. So it might make you a better performer in a marathon or in a cycling race. But the act of working on your cardiorespiratory fitness improves your overall health. The benefits of improving your VO2 or even attempting to VO2 pays off in huge dividends on your overall health and well-being and your longevity in terms of mortality and morbidity. And so if you've got a VO2 max number that's below your relative gender and age range, especially if in the context of other health markers, it should be literally that proverbial kick in the butt to get yourself moving and exercising.
What if we get our number and we're troubled by it? You know, our physician says that's lower, that's in the lower range. What if we want to increase it? Do we have anything on that? Do we have any tape on what we do if we want to increase our VO2 max?
We do. Dustin says there's a very specific way of starting to increase that number. So say I live a predominantly sedentary lifestyle. If I needed to boost my VO2 max by like 10%, what would I need to do?
So I'll go back to a previous question. You would have to engage in aerobically challenging cardiovascular exercise. Specifically, we know that high-intensity interval training is the most efficient way to increase your VO2. It's the best, training bang for your training buck type of thing. High-intensity interval training, it could be a 30-minute exercise bout where interspersed every 3, 4, 5 minutes we have a super high intensity 30 seconds or 1 minute. But that's the style of exercise that we need to engage in to raise our VO2 max.
Dustin puts it a really great way. He says the body doesn't like to be uncomfortable, and so when you push it to be uncomfortable, it's going to do its best to get comfortable again. So there's been an increasing interest in VO2 max in general. Do you think that the medical profession has paid enough attention to VO2 max?
I think we're getting there.
Okay.
I really think we're getting there. The general population is overall improving in their basic knowledge of what a VO2 max is. The millions and millions of people listening to this podcast now know what it is. So I think we're getting there.
Okay.
We've learned over the last 5, 10, 15-ish years the great medical benefits of a healthy VO2 max. I don't have a prescription pad in my office. I wish I did. I wish I could write on the prescription pad a very brief, high-intensity interval training program for the person and put my signature at the bottom and have them take it, and they must fill it as they would with any other prescription. And boy, would that solve a lot of our overarching general healthcare challenges.
Great. So do you think that one day VO2 max would be considered a vital sign?
Absolutely, yes.
Okay.
There's too much evidence, still growing evidence, suggesting that it needs to be.
Things are changing. The medical establishment is understanding more and more that fitness and aerobic fitness is an important thing to incorporate into overall assessments of wellness, whether that's the annual physical you get at your garden variety doctor or whether that's the 5-hour physical that happens at Medcan, the annual health assessment.
And so we wanted to build the VO2 max into just about everything that a doctor does. So at the end of the day, there's going to be a wrap up with the physician. And the physician's going to have access to this information. And I'm actually working with our physicians, and these are physicians that thoroughly believe in prevention, health, and wellness. And it's so easy for the physician to focus on maybe some clinical pathology. They've got high blood pressure or congestive heart failure, other things that's taking their attention. And part of what I'm focusing on for the next 6 to 12 months is, despite that, not to have such a narrow focus, but keep the focus wide. And really, even with those conditions, certainly we're going to treat those conditions. We're going to make recommendations about how to benefit those conditions, but also think about two things. Think about fitness and nutrition. We have those services at Medcan. Let's take advantage of them. Let's take advantage of the full ecosystem of services that Medcan offers, and let's really leverage the technology that we have right now and the results that we have to create a holistic view of health. And VO2 max, and in this case a sub-max, this data that we get is critically important to the overall health picture that we're creating for people.
We've been on this continuum of understanding that exercise is important to overall wellness, and we're one more step on that journey. And thank you so much, Dr. Peter Nord. Thank you so much, Dr. Andrew Miners, for helping us work through that today.
Yes, thank you.
Great to be here.
Yeah, thanks.
That was Medcan's Chief Medical Officer, Dr. Peter Nord, in conversation with Dr. Andrew Miners, Medcan's Clinical and Product Director of Sports Medicine, Therapy, Rehabilitation, and Fitness.
This episode also featured interviews with Dustin Kahn, a VO2 Max expert and exercise physiologist at Medcan,
Dr. Robert Ross, Professor of Exercise Physiology in the School of Kinesiology and Health Studies at Queen's,
and Dr. Jordan Metzel, renowned sports medicine physician, best-selling author, and fitness instructor in New York.
Want to know your VO2 Max score? If you're near Toronto or Oakville, you can book your annual health assessment at Medcan by calling 416-350-3621 or emailing clientservice@medcan.com.
We'll post episode highlights and links you can visit on our website, eatmovethinkpodcast.com. Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com, and follow Medcan on Twitter and Instagram at MedcanLiveWell.
Eat Move Think is produced by Ghost Bureau. Senior producer is Russell Gregg. I'm Jasmine Ratch, managing producer.
Social media and strategy support is from Chantal Gertan and Andrew Imax, and I'm executive producer Christopher Scholger.
We'll be back soon with a new episode examining the latest in health and wellness.
This podcast is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with the specific information highlighted. Any third-party links are not endorsed by Medcan.